Welcome everybody to the World of Pets, which is a show on the World of Ability Podcast Network. And I am Emily, the podcast engineer here for the show with Patty Ernest, who is the show is for this person's show. And we also have Joy Baker joining us today. And I'd like to give special thanks to Marcus Hart, Jess Dorian, and Zach Clayton for allowing us the show to be on their platforms. But I'm going to hand it over to Patty to get us started today.
Well, thank you, Emily. I appreciate that. As Emily has mentioned, Dr. Joy Baker is joining us as a special guest today. And as far as my background, I have been pet sitting for 28 years and love it. I'm in the Phoenix area. Joy, give us some background of how you got started and why you find the field of veterinary medicine so fascinating.
Well, I mean, it's hard to believe I've been a small animal veterinarian for almost 10 years now. I graduated from Colorado State in 2013. And I remember the first time, so let me start by saying I had to apply to vet school 3 times before I got in. That wasn't necessarily for lack of skill or credentials. It was basically because the same issue that there is today, there's more people trying to get in than there is positions. The year that I finally got accepted to Colorado State, I had 140 students in my class out of 1,100 people that had applied just to CSU alone that given year. But when I first submitted my application for vet school, because you have to submit a personal essay, basically explaining why you want to become a veterinarian. And the first time that I wrote that essay, I wrote about the very first dog that I had as a child. I'm an only child, at least as far as I know. I haven't had any surprise siblings pop up anywhere. So I had a dog growing up. His name was Ben. And this was before you could go into the store and buy clothes that were specifically made for your dogs. Ben, mind you, he was a boy, was dressed up in baby doll clothes. Dresses sometimes probably gave him a complex. But going back to this essay that I wrote for school, when I first wrote the essay, I wrote about him and how much I loved him. Basically, I guess as far as getting into school, they didn't really want to hear so much of the personal stuff. At least the advice that I got was to go back and rewrite that essay. And when I did, I wrote about how I had fallen in love basically with the scientific aspect. So I love animals, of course, but the reason why I wrote about my dog was because he had given so much to me. I wanted to, well, he had since passed away. However, I wanted to be able to help other dogs in the future to stay as healthy as they could for their owners, because I know how much he had meant to me. And so I kind of paying it forward, I guess. So when I went back in to rewrite that essay, I think I changed it a little bit to meet that. So I mean, yeah, mine started with a passion for animals, as everyone that gets into this profession does. When I was in school, it changed to, I fell in love with the client education portion of the profession. My favorite clients these days are first-time dog and cat owners, because I like to be that first point of contact, that first person that they're going to go to get the information that they need to care for their animals, rather than Google is a good resource if used the right way, but I would rather that first contact and that first set of information to come from a veterinarian such as myself. So that's what I find fascinating about it, and why I enjoy it so much to this day, is the coupling of getting to see all the animals and take care of them, but also helping the clients out as well.
I'm gonna thank you for sharing that. It's very fascinating. It really is. You mentioned you had to do the essay a third time. What was the difference between how you did it a second time and how you did it a third time?
Well, just to clarify, it was just the 2 times that I did it. The second time, I still kept the personal aspect in there, but I talked about how much I loved basically the science behind everything, like the science behind, figuring out the diseases and how they affect the body, being able to diagnose them. I think I talked about that one of my favorite classes was in undergrad was my genetics course, and just learning how calico cats are, it's a X chromosome trait, and I believe they're almost all male, but anyway, it was just fascinating. I mean, to this day, I'm still fascinated by the science of how the body works, and all of that. So, like I said, I kept some of the personal story in there, but I just basically, I guess, gave them a little bit more of what they wanted to hear, meaning I think they just wanted to hear that I liked going to school, because I would have to go to school for 4 more years. So I think they just wanted to hear that I actually liked, learning, I guess, which, I mean, I do. I enjoy learning more now because I get to pick my continuing education courses that I go to. So yeah.
So you went for a total of 8 years schooling?
8, including undergrad. Yes, undergrad for 4, and then vet school was 4.
And then I know this, but just for purposes of the listeners, so you were in Colorado, but you're from the Phoenix area, correct?
Yeah, so I was born in Arizona. My dad was in the Army when I was younger, so we moved around a little bit. When people ask me where I grew up, I just always say Arizona, because I was 9 years old when we moved back to the Phoenix area. And then I was here through undergrad, and then lived in Colorado for the 4 years of vet school, and then moved back because at the time there was no in-state veterinary school options. And I went as part of, they called it, we were known as WICHE students, which stood for Western Interstate Colleges for Higher Education. Basically, I went to school in Colorado and paid in-state tuition, even though I had not established residency. The state of Arizona paid the other portion of my tuition. So when I graduated, I basically had to come back and work in Arizona as a way of repaying the state, basically, for those 4 years.
Yeah, it's all very interesting. As you know, I have a master's in public administration, so I also have I've gone 6 years. Actually 5.5. So it fascinates me about the educational process. Do you have any guesses on why the difference? What made the difference in them opening a school in Arizona for studying veterinary medicine? Do you have any guesses on what contributed to that?
You mean what contributed to them opening a vet school here in Arizona?
Mhm.
Well,
Why
to this
don't-
Yeah, to this day, Arizona is considered an underserved state when it comes to veterinarians, especially in not so much in the greater Phoenix area. I feel like in Phoenix, there's one on almost every corner. But when you go to places such as Yuma, up around like Lake Havasu, um, I guess more down south, really, like Tucson area, even. Um, so the rural areas, I guess, of Arizona are still considered underserved. And so that would be, I guess, one of the guesses I would have as to a reason why they would do that. It might have been cheaper for them to do that overall rather than continuing to pay, for us to go out of state. Like, even though we were coming back to Arizona, out of state tuition is always more expensive, of course. So it may have just been cheaper for them overall to do it that way. So there's two in Arizona. They had Midwestern for a while, but my understanding is that that is a private school and still really expensive. And so that's why they opened the veterinary school down at U of A, because that gives the public school in-state option, which is a little cheaper. And I think the University of Arizona is graduating their first class of veterinary students this summer.
Terrific.
Yeah.
Terrific. So you have a specialized field in what you do as compared to, as you described, the veterinary practices that appear to be on almost every corner in the Phoenix area. Why don't you, if you will, please share with the listeners what it is that you do specifically that makes your practice in particular so special.
I currently do not work at a stationary animal hospital. I work for two different companies. One is VIP Pet Care. The other is Vetco. And as you can guess, the parent company for that organization is Petco. And with those two companies, I'm basically an independent contractor, but we do mobile vaccine and wellness clinics. The Vetco company is a more local company. Usually the furthest that I will go with that company is I do go and work the clinics in Tucson for that company sometimes. The VIP Pet Care is the one I feel that goes to more of the outskirts of the state. That is the one where I've done Lake Havasu, Bullhead City. I do Yuma quite often. Just this past Saturday, or not Saturday, sorry, just yesterday, I was in Douglas and Sierra Vista. They also do a Sierra Vista Nogales run that I've done. They go to Globe in Miami. And it's really bringing our services to these areas that are underserved. We've seen, even our clinics here in Phoenix stay, well, depending on the location, stay relatively busy because, as we all know, COVID messed up everything. And it's been harder for people to get into, full service hospitals, even for simple things like vaccines and such. So even here in Phoenix, we've had people say that it's going to take me 4 months, to get in to my regular vet, to get a vaccine. So
how long have you been working for these couple companies?
Let's see, VIP Pet Care is the first one I started working with. I worked with them before COVID, so I think I started in 2017. At that time, I was still working at a full service stationary hospital, and I would basically do these VIP pet care clinics mostly on the weekends. And then I started with Vetco because after COVID shut everything down, the Vetco clinics opened back up before VIP Pet Care did. And so it just gave me an opportunity to get back to work a little bit quicker. But I mean, like I said, it really works out. The Vetco clinics are mostly the ones that I do during the week, and then VIP Pet Care still has most of theirs on the weekends.
An excellent background in what you do. I would like to hit on some of the important controversies, or at least discussions that go on in today's world. One of which has to do with spay neutering. How significant, how important is spay neutering?
Well, I mean, of course, I feel like I might be a little bit biased in that I think that it's really important. That's coming from the doctor's perspective. And there have been some changes recently. We used to say, all dogs, spay or neuter, around 5 or 6 months of age. I would say within the past 6 months, there have been some changes where they are saying that for the larger breed dogs, I would say dogs that are going to be, like over 40 pounds, that they're saying that it's better to wait. And when I say they, I'm talking about like the AVMA, the big animal, companies that do research on these things.
What is it? And for clarification purpose, excuse me, what is AVMA?
Yeah, I'm sorry. I use I have a bad habit of using nomenclature that's normal to me. It stands for the American Veterinary Medical Association. It's a nationwide thing, and then each state has their own chapter. Anyway, and then you have AAHA, which is the American Animal Hospital Association. But anyway, their recommendations lately have been that for these larger dogs to wait longer, closer to like 9 months to a year, because they have shown that neutering or spaying these dogs earlier has had an effect on their growth. But as far as just in general, whether you should or you shouldn't, I believe that you should, because studies have shown that when you, so let's take the example of females and being spayed. I can't remember the percentages exactly, but if you have your female dog spayed either before their first heat cycle, or if they only go through one heat cycle, you decrease their chances of getting mammary tumors or ovarian cancer by a huge amount. Like I said, I can't remember the specific percentage numbers, but the same is for males, because all of the ovarian cancers, the mammary tumors, even testicular cancer in dogs, I don't know if it's the same for people, but they're mostly hormone driven, I would say. So when you get them spayed or neutered, you get rid of those hormones that are causing a lot of the issues. I also think it helps to decrease those, whoops litters, or those accidental, pregnancies. I mean, I've seen it even, just in, dogs in the same household. You don't think, that your own dogs would, do that, right? They live, but they're just animals. They're not going to be like, oh, this is, my sister or whatever, they're like, we're housemates, but they're just animals. And so I think it helps to prevent those, unwanted litters. I love, and I'm sure you guys know, the TV show The Price is Right. And you know how Bob Barker, when he was hosting that show, the last thing that he would say on the show was, help control the pet population, have your, animals spayed or neutered. And now that Drew Carey is the host, they've kept that in there. Like he still says that at the end of the show. And I'm like, I mean, they probably do that as an honor to Bob Barker. But I mean, I don't know if they do. I'm assuming that's why they, kept it in there. So I think that's a huge part of it as well. So there's the medical aspect, and then of course just the keeping down the unwanted animals.
For clarification purposes, you mentioned before about waiting a bit longer in terms of growth for the larger pets, like the larger dogs, for instance. But you, do you think that, if the situation is such that they can't wait longer, how do I ask this? If there's a decision to be made as to whether to spay or neuter a larger dog, you someone would say, well, we have to wait. There's no have to about that statement, correct?
It's one of those things where it's not, you always have, everyone has the personal choice. You don't ever have to do anything. It's just what's recommended, kind of as something that would be, healthier for the dog. But it's also, let's say, let's say you do have, you have two puppies. They're both, around the same age, and male and female, and your female is going into heat, first heat cycle. They can go into their first heat cycle around 6 months of age, but you don't want your 6-month-old, female puppy, to get pregnant. Well, I mean, and let's say your 6-month-old male that you have is, a Great Dane. Okay, they're definitely in the large dog category. I mean, I guess maybe in that situation, depending on what your female dog is, I may say, okay, if you're not going to breed your female, maybe perhaps have your female spayed, rather than spaying your male, because your male is a large breed dog. But however, if you like I said, you don't want puppies, and that you're not going to be able to watch them 100% of the time, if you have to get that, male dog neutered, I think it would be better to have the dog neutered than to have, 5 or 6 puppies that, that you don't want, and, because they were an oops litter, so I think you have to weigh and take every situation, on its, we have these general guidelines, but at the same time you have to look at every situation kind of, on its own, and kind of think about what is best in that specific situation.
On the other hand, I personally have had, in this case it was cats, but I've also, same situation, I've had dogs as well, spayed at 3 months, and there has been no issue in terms of their growth and development at that age. It's better to have it done now situation. And so it, as you're saying, it depends, but in general, what I'm hearing is that if you can wait to have the larger dogs spayed, neutered later on, it's better for their growth and development, if that's if that's possible for the situation. Am I correct in what I'm hearing?
Yes.
Okay. I have a question about somebody who I met at the park the other day, dog park. There was this guy who was saying that he I think the dog was like, I don't know, 10 or 12. I don't remember how old the dog was, but it was a senior dog.
Mhm,
And he was in a situation of wanting to have the dog neutered.
mhm.
The vet recommended against him neutering the dog at that age. Does that make sense?
Did the gentleman mention any other underlying issues that the dog had?
I didn't hear them.
Okay. I can't, I mean, I can't think of, and just because I can't think of it doesn't mean that they don't exist, but I can't think of any reasons off the top of my head why an older dog, couldn't be neutered. The things that come to mind are, like I said, if he also has an underlying, heart condition, because that can sometimes make the anesthesia portion of the surgery a little bit more risky. Not impossible. It's just you have to do a little bit more intense, monitoring of the patient, parameters and things like that. Or if there was some other underlying issue, but I can't think of anything outright that would preclude an older dog from being neutered.
And Joy, if you had seen the way that this dog was running around the park, you'd question whether he had any underlying issues.
Oh, okay.
Yeah, he was giving Daisy a run for her money. Okay.
Yeah.
So, talk with us about the importance of shots. Now, I always recommend to my clients as a pet sitter that they at least have the rabies shot because it is required by the state. However, I also, as you're aware, have had two vets in past history and history that both have recommended about getting any other shots because they have seen kids as I call them, actually get sick on the shots. So they've recommended against any further shots. What are your feelings about that? What are your thoughts and your scientific background on that?
So these doctors that you're talking about, they had a dog that had gotten sick from a particular shot. And so for that specific dog, they didn't recommend any further shots, or they just don't recommend shots at all for any dogs.
They recommend two of them, independent of each other. They didn't know each other. Both said the same thing. Neither one recommended any further shots beyond the rabies. And the rabies they did hesitatingly.
Okay. Do you mind if I ask how old these doctors are?
One of them is, I believe, both of them.
You don't have to if you don't feel comfortable answering that. I was just wondering because
I don't have any problem with that. Both of them, I know at least one of them is retired. I believe the second one is also. Both retired, retirement age.
Right. I can't speak to, any, personal experiences, that they, may have had as to, why they, came to that conclusion. All that I can speak to is my personal experience. I've seen unvaccinated dogs die of parvo. And to me, it's a very painful, slow, agonizing death unless you choose to, have them put down, to put them out of their misery if you can't, afford the treatment. So in my mind, when we have a vaccine that can work to prevent that, I feel like it's something that we should use. It is unfortunately a catch-22 because, like for people, you don't know what dogs are going to have a reaction to any of the vaccines until you give them. I understand that. I think that you have to weigh what is worse. The potential reactions to the vaccine versus potentially getting the disease that the vaccine is trying to prevent. I've also seen dogs that get distemper, and although they are treated and come through it, they continue to have tremors for the rest of their life, in their legs. So like you said, rabies is the one that's required by law. I had someone at one of the clinics the other day, say, well, we don't have rabies anywhere. Why, rabies is rabies even still out there? Why do we have to get the rabies vaccine? Rabies is still out there. You don't hear about it, but you've got prairie dogs that, are coming down with rabies. You have raccoons that get rabies. There have been dogs that have been diagnosed with rabies. You're just not hearing about it in the news. And I think probably the reason why rabies is the one that is pushed or required by law is because rabies is something that people can get and die from. So you're protecting the animals from getting it, so the people that live with those animals don't get exposed. We actually as doctors, we had to get our pre-exposure rabies vaccines before our third year of vet school, before we started working in the clinics. And we did have, I remember my senior year, there was a horse that came through the hospital that had rabies, and one other animal, I can't remember. And those people that were exposed because they had their pre-exposure rabies vaccines, they only had to get one post-exposure vaccine versus like the whole series. And then I've heard that it's painful anyway, intra-abdominal injection that you have to get of the, I always want to say amino acids, but that's not, immunoglobulins is the word I'm looking for. Anyway, so, I mean, again, it's something that's on a case-by-case basis. I feel like the core vaccines that we recommend for dogs, so like your distemper, parvo, yeah, I mean, Bordetella can sometimes be considered core. That's the one for kennel cough. I don't know. I just feel like there are some consequences or potential adverse reactions to the vaccines, but I just feel that I feel like they help more animals than they harm. Like I said, it is unfortunate that you don't know which ones are going to have an allergic reaction to the vaccine until you give it. If I have a dog that's had a previous vaccine reaction, of course, I'm not going to tell those owners to keep vaccinating that dog. But in my opinion, that's all the more reason why the dogs that can get vaccines should get them. Because like I said, parvo is a horrible disease. I've had to euthanize 16-week-old puppies with parvo because their owners couldn't afford treatment. Now that's something where the dog is still, a 16-week-old puppy, you might say, this dog, had, 2 vaccines prior, because the distemper parvo vaccines, it's usually you get them at 8 weeks, 12 weeks, and 16 weeks. And the reason why you do that is because it gives you increasing immunity and allows the system to build up the proper amount of immunity by doing those boosters. So a 16-week-old puppy, they've probably had at least 2 distemper parvo vaccines. So they're kind of still, pretty vulnerable because, they haven't had their full set of vaccines yet. But I mean, I'm just saying, you know, if you're have an unvaccinated dog, a dog that's 5 years old could get distemper or parvo. And they're both just, I mean, I had to use, I had this one client and I thought this lady was going to hate me forever because her dog got distemper. And unfortunately, I didn't recognize it soon enough because distemper a lot of times usually presents as an upper respiratory infection. And then it moves to the GI tract, or sometimes the GI signs occur with the upper respiratory. But once they develop the neurologic signs of distemper, there's usually not a whole lot that you can do for them. This lady had, I can't remember how old her puppy was. It was less than a year. And he progressed through the symptoms of distemper. And, we had to euthanize this puppy. Like I said, I thought this owner was going to hate me forever. The next time she came, through the doors with her other dog that was older that she had, she actually requested me as her doctor, which shocked me because I thought, I had to put down her puppy. I thought, she's never going to want to see me again. But I must have done something right in the way that I handled that. But I mean, I don't know. I'm just saying that I just feel like that the consequences of not vaccinating are greater than the consequences of vaccinating. But again, it's on a case-by-case basis. You have to take it that can't just be a blanket statement, for everyone. You have to, I still feel like that it, has to be a case-by-case basis.
How expensive is it for the parvo or the other treatments? Somebody comes down with them. How expensive is it?
Parvo, if you're talking about in-hospital treatment with IV fluids, IV antibiotics usually because they're not eating because they don't feel well. Let's say 3 days in the hospital, which is pretty typical, probably in the range of $2,000 to $3,000.
Wow.
This day maybe more with inflation and everything.
Wow.
But I mean, again, that's so, and that was one of the things that can be hard is, and they teach you this in school. The saying that they have in school is that we have to stay on our side of the exam table when it comes to making recommendations for patient care. Meaning, I need to present, when I present a treatment plan to the client, it's got to be, plan A, the best, plan for care. I can't look at the client across the table and make a judgment call on what I think that they can afford. As a doctor, I just need to present, the best possible care that there is. Now, and I say that because when you ask that question, so for parvo patients, we, had that hospitalization treatment plan, like I said, where it's, usually they're in the hospital for 2 or 3 nights. We're doing IV fluids, we're doing really aggressive therapy. We had a plan B if the clients couldn't afford that, which was we would show the clients how to do sub-Q fluids. Now, sub-Q fluids are not as good as IV fluids when it comes to rehydrating the patient really quickly, but it's something. It's still getting fluid back into the patient. So it would be sub-Q fluids. You would try to do oral antibiotics at home, oral anti-nausea medications to try. Well, no, we would still, I think we would still offer the injectable anti-nausea medications. So there was kind of an at-home treatment plan that we would offer, that one was probably still, I would say, maybe at least close to 1,000. But I mean, that's including, that exam, that initial parvo test. So, but anyway, so there were two different ways to approach it. But like I said, as a doctor, we have to present the best possible, and let the client be the one to say, hey, I can't do this, what else can we do? And then you have a plan B ready in place, but it's not up to me to make that judgment call.
And as an alternative, there are also programs within the state. I don't know what they are off the top of my head. There are programs that will assist with medical issues, animal medical issues. Are you aware of any of the ones that are available? I can't think of what they are off the top of my head.
I don't know about through the state. I know of Care Credit. A lot more veterinary offices are accepting Care Credit, which is the medical credit card, basically, where the vet's office, still gets paid from and you're paying the credit card company. I mean, just like you would any other credit card. But I've heard that they do 6 months, no interest, but I've heard at the end of that 6 months, that interest rate is really high on Care Credit. I'm not sure of any other state services. I do know insurance is becoming a more popular option for pet owners. I remember 10 years ago, there was maybe 1 or 2 pet insurance companies out there. Nationwide now has got into pet insurance. Nationwide, I want to say, is it VIP Pet Care? I mean, not Pet Care. Or is it VP? AV? I can't remember the initials now, but I know there's probably at least 3 or 4 pet insurance agencies out there. That's something where you get a new puppy, you sign up for pet insurance right away, because it's kind of like us. You can't wait for them to get sick and then sign up for, pet insurance for them. But my understanding is how a lot of them work is it's you would pay for the bill and then send in to get reimbursement from the insurance company.
Yeah, I'm thinking more in terms of like some of the charities, like what some of the charities that are, like, for instance, are on Facebook or Nextdoor. And then also, setting up possibly a GoFundMe account at times might become necessary. So
Yeah.
perhaps there are ways of working, and making sure that those who don't want to lose their kids, might be able to find some of these possibilities. So,
Yeah, and I think there's some, if you, like my parents have been using the same veterinarian, gosh, I guess for 12, 13 years now. And because they have that relationship, they let my mom, make payments on stuff. I mean, even things like dental procedures, things like that. And so I am sure that there's some offices out there that, if you have that relationship established, that they, they're gonna try to work with you. I feel like one of the hardest things for a lot of us in this profession is we wish that we could practice, for free. We wish that we didn't have to charge anything because we care so much about the animals and, when we want to fix them all. But unfortunately, you have to have money to continue to buy supplies and to, continue to keep your business running. I think there was one veterinarian, I can't remember where he was living, that won the lottery, and they asked him what he was going to do with it, and he said he was going to practice until the money ran out. So I don't know how long it lasted him, but I mean, if I could do this job and like not, for free, if things didn't cost money, right? It would be the ultimate, if things didn't cost money. Yeah.
And along that line, what are your thoughts on giving pets, whether they be large or small, as gifts, whether that be Christmas, birthday, or otherwise? What are your thoughts on giving pets as gifts? Hi, Angie.
I think it's a horrible idea. I know that's a very black and white statement, but for me, it's just that simple. Especially for kids. But I think even for adults, I mean, yeah, even for an adult, if you have someone that, yeah, maybe they've talked about, oh, it would be neat, to have a puppy, but it's like they may say that, but they may not be completely ready to, take care of, said puppy or, whatever you give them. You just may hear them kind of nonchalantly, like, or mentioning it like in passing and be like, oh, like I'm going to surprise this person with a puppy. But especially for kids, kids, and each kid's different as far as, how old, what, because the next question is, okay, well, what age do you think is age appropriate for, a kid, to have a dog? At what age are they responsible enough? Again, I feel like that's on an independent basis. There are some kids that may be ready to help take care of a dog at, 8 years old. There may be some that may not be ready until they're 10 or 12. But surprising them, like, just because, oh, you think, it's cute. No, because especially when they're too young, you got to understand you're going to be the one taking care of the pet. And if you're not ready to do that, it's just not going to be good. I know for me personally, I had, gosh, was I like 7 or 8? Sorry, I heard my dog chewing on something and I just had to make sure it was her own toy, not the carpet. Anyway, yeah, I was surprised with a guinea pig. I think I was like 7 or 8 years old. And well, the first thing was my parents did not know that for guinea pigs, you have to supplement vitamin C in their diet. We didn't know that. And so he developed a lump on his back. I don't know if it was related to the not having enough vitamin C. But he was kind of, once the newness wore off, I didn't want to clean his cage anymore. I rarely, I didn't play with him as much. Now, when I was older, I think I was in junior high school, when I decided to get, my next guinea pig, I did all the research for it. And it was totally on me. But any kind of living creature, meaning animals, maybe even plants, I don't know, but animals for sure, I don't think that they make good surprise gifts at any time, any age. It's just, yeah, because usually they're just not well thought out, and it just leads to a lot of problems, I feel like. That's just my personal opinion. I don't know.
And we're making a distinction between the use of the term kids. When I say kids, I'm referring to the fur babies. But when you're talking about kids, you're talking about the human variety.
Right. In this scenario, yes. Surprising human children with four-legged children is not a good thing.
I have one last question for you, and then we're coming close to the hour here. I was at the park the other day, and there was a fight that broke out with, is Angie okay?
Oh yeah.
There was a fight that broke out in the larger area,
Mhm.
where you and I were, with two pit bulls.
Mhm.
Now, as I heard the story, I did not see the dogs, but as I heard the story, the fight went on. It didn't just, it was over and done with. Okay, it went
Mhm.
on. And one of the gals that I was sitting with, we're in the smaller area, went over and said something to the people involved, to the parents involved. Somebody else who was sitting next to us said, "You should not have done that. You should not have interfered."
Mhm.
My question to you is, one, would you have interfered? And two, how would you have handled it?
So you're saying this person went up to the owners of the, or one of the owners of the two dogs got in the fight and said something? Do you mind if I ask did you hear what she said to them? Do you mind if I ask specifically what she said?
Um, as I heard from what she was saying afterwards, was she just simply asked them to stop, and apparently they did. They got the kids to stop, but it created quite a controversy among the people I was sitting with, because most of them were saying you shouldn't have done anything. It could only lead to trouble. And one of the guys who came over to us said that there was a concern that no matter what situation that you put a pit bull in, the pit bull is going to show us, in his words now, not mine,
Mhm.
its true colors of fighting instinct. My
Mhm.
response to that was, it depends on the parents. It
Yeah.
does not depend on the pit bull. It depends on the parents, because I have on my Facebook page, the pin that I have on my Facebook page shows a pit bull who's rolled over on her back with her legs straight up in the air, and it's on my pin purposely
Mhm.
to show this is the true nature of pit bulls, not the fighting that people are saying. Anyway, that's so it was quite a controversy among everybody that she actually had the audacity, as they put it, to go over to these folks and say, "Hey, this should not be happening." She didn't put it that way. She was much more diplomatic than I would have been. Okay. But then again, I think the way I would have handled it myself would have been to offer them one of my pet sitting cards and say, if you want me to take care of your kids in their own home, I'd be glad to do so. You know, um, that's my entrepreneurship coming out. But anyway, what are your thoughts on that? How would you have handled that situation, or would you have just ignored it?
Um, I don't know if I would have been, first of all, I don't know if I would have been one of the people to, um, like jump in and try to end the dog fight unless I saw that no one else, was doing anything about it.
Was doing
My
anything about it?
Usually my instinct is to, once someone else has gotten the dogs apart, I go into doctor mode and I want to go over and make sure that the dogs are okay. I've had
Yeah,
some people, I've had some people that are like, back off, don't touch my dog, whatever. Usually when I explain to them, I just want to, make sure they're okay, you know. I don't know that I would have confronted them about, oh my gosh, your dog is a horrible dog, like you need to get out of here, like what are you doing, like I don't know if I would have confronted them in that way.
you didn't,
If someone, huh?
you didn't confront them in a negative way. she confronted them in the way of, you know, we need to have some peace in this park type thing. You know, she wasn't
Right.
bad to them, you know, and she didn't end up getting clobbered for it either.
Right. I mean, I probably would have asked them to leave, because, you know, if their dogs, because sometimes in situations like that, two dogs in a fight will get the other dogs, you know, on edge and can cause other, you know, instances. And so, you know, if their dog's behavior is affecting other dogs in the park, or if I felt like that that I didn't feel that my dog was safe, I may either ask them to leave, and then if they chose to stay, then I probably would have walked out with my dog. If I felt like that their dog's behavior was putting my dog in danger, if they weren't going to leave, then I would have walked out with my dog. If I would have been there and heard the gentleman say something like make that general statement about, you know, pit bulls and I would have gone off on that person. not in a negative way. I wouldn't have, you know, there wouldn't have been any bad words or anything like that. I wouldn't have cussed him out or anything like that. But I mean, I would have made a statement to the regard of, you know, even in my profession, and I tell people this, I come out and say, you know what, I'm more afraid of this Chihuahua over here than this pit bull. like I've been bit by more Chihuahuas. I would say 90% of the pit bulls that I meet as a doctor are the biggest babies. You know, they'll come up to you, they'll bury their heads in you, they you know, they just want to be pet. Anytime I see a quote unquote bad dog, whether it be pit bull, German Shepherd, Chihuahua, Shih Tzu, Husky, whatever, I'm going to look as much to the owner as I do the dog. I think of, this was on the news, oh gosh, maybe a month or so ago now. It happened to be a pit bull. And see, we only hear about the bad pit bulls in the news. We don't hear about the nice ones. Anyway, and I know I'm talking a lot, but anyway, this lady was walking her golden doodle down the street, and this other lady on the other side of the street had a pit bull. The pit bull got away from this lady, attacked the golden doodle. It took them several minutes to get the dogs apart. Once they did, the pit bull owner took off, did not stick around, did not take responsibility for what her dog did. The golden doodle's front leg wound up having to be amputated. But for me, I wasn't so much angry at this pit bull. I was angry at the owner of this dog that did not stick around and take responsibility for what her dog did.
Absolutely.
Dogs, cats, they're all animals, right? And so sometimes those animal instincts do kick in. I understand that. But I think with one, you have to know your dog. Angie had to go through some extensive training. She still barks sometimes when people come over, but I can give her a command and she goes and lays down. So one, you have to know your animal. Two, with training, I think a lot of that can be, you know, curtailed or, you know, worked around. So if you want to say it that way, so training and, you know, just knowing your dog. You know, there may be some dogs out there that may have to be a single dog household. You know, they just, for whatever reason, even with all the training in the world, can't get along with other dogs. If you know that, that's okay. You just don't get another dog while you have that one. You know, you only take it to the park maybe later at night or really early in the morning when there's no one else there, you know, to let it get some exercise or whatever. but that's just knowing your dog.
Mhm.
Anyway.
I agree with you. And I let off in a very let's just say humane way with this man. In terms of showing him telling him about the picture that I had on Facebook and telling him, that I've taken care of pit bulls that are very gentle by nature. They're big babies.
Yeah.
Chihuahuas think they're pit bulls. I had a Chihuahua. And he thought he was feisty, right? But overall he was you knew him, Doogie. He was a super kid. I miss him to this day. So yeah, and what I did, what I stated very matter of factly to this gentleman is, it depends on who the parents are, and it does. So I had a Chihuahua, believe it or not, in my hands, in my arms, when all this was happening. So I couldn't go over, but I would have. I would have gone over, and again, I would have offered my car. That would have been my way of handling it. But I would not have backed down from it, simply because I wouldn't have wanted to encourage the pit bulls to think that it was acceptable what was going on. To breed that in them, oh yeah, this is fine, this is cool. So that would have been my reasoning. She handled it very well. She was able to separate them. She was able to bring to their attention that this was not something that should be going on, especially not at the park.
Right.
So yeah, I would have wanted to have joined her. I could see both sides of it though, because the other people who were talking had already had confrontations with people in the park where things didn't end well.
Okay.
So
yeah.
There's that in that. So yeah, I appreciate your feedback. I appreciate you being here as a guest. You know that I value your friendship very much. And I look forward to talking with you again soon.
Yeah. Of course, yeah. Thank you for having me. It was really a lot of fun.
Thank you. Emily, are you still here?
Yes, I am.
Okay. Do you have any final thoughts that you would like to add to this discussion?
I thought it was a very interesting conversation. And a very good conversation. So anyway, and thank you, Joyce, for coming on. You're welcome to come back anytime. Join us again anytime.
Yeah, like I said,
We're here every Monday at the same time. So if another time works for you, you're always to join us. Right, Patty?
Absolutely, yes, absolutely. We appreciate you being here.
Yeah, like I said, thanks for having me.
You do a tremendous service to the community. I should say for the state.
Yeah.
Right, I'd like to again thank Joy for coming on, and for everybody who has tuned in. Again, special thanks to Marcus Hart from Transforming Media, Jay Stoyan of the Disability Channel, Zach Clayton of the PAC Channel. Oh geez. For allowing us to have this show on their platform, and I will show myself here. Would also encourage everybody to check out all of our social media and like, subscribe, share, its own. And is for, on behalf of Patty, Kurt, and the rest of the World of Ability Podcast Network. We wish everybody a safe and productive week and to stay happy.